Hello everyone. So in today's video I am going to revise my topic, that is genital ulcer disease, and I made this video from the sources from where I used to learn. So please don't mind it. If you want to revise your topic, then just see this whole video. Now let's start it. So genital ulcer disease. So as the name comes, genital ulcer disease, what things is used to come to our mind? We there is like there are 5 disease which cause genital ulcer disease. So genital ulcer is caused by 5 diseases. Now the first one is the syphilis, which we already know. The second one is the chancroid. Please remember chancroid. So second disease is chancroid. The third one is the herpes simplex virus. The fourth one is the LGV, lymphogranuloma venereum, and the fourth one is donovanosis. Donovanosis. So these are the 5 diseases which causes the genital ulcers. Now I am going to revise in this topic these 4 diseases, that is the Chancroid, HSV, LGV and Donovanosis. So now let's start it with the Chancroid. So as the name comes, Chancroid, these are not the chancres which we used to find in the syphilis. These are the Chancroid. From the Chancroid, one thing must know that these are soft chancres. These are soft chancres, means that they are non-indurated. Non-indurated, and what's the difference between non-indurated and indurated? So as I wrote, whenever I used to talk about non-indurated, it means that those were the soft, and when I say indurated, those means that those are hard. So the chancroid is used to be soft, means that these are non-indurated, means ni. Non-indurated chancroid were the soft chancres. Now what is the etiology of the chancroid? So for the etiology, it is Haemophilus duceri. Whatever is the pronunciation for duceri, I don't care about it, because my just aim is to learn about it. So Haemophilus duceri, and I used to pronunciate it like do cry, because these chancroids make us cry, because these are painful. So these are painful, that's why it make us cry. So you can remember chancroid were the soft. They are soft but they are painful, so they make us cry. That's why the etiology is Haemophilus do cry, means make us cry. So do see cry, that is do cry. Now for this we have to remember few points, like that these are soft chancre, because first of all there is primary lesion will be small pustule, and when they open to form a genital ulcer, when they used to break up and they open and they cause soft chancre, which are non-indurated, means they are soft, that's why they are non-indurated. And there is one more term, that is the tender. Tender means that they are painful, and non-tender means that they are not painful, they are painless. So non-tender. So non-tender means that they are painless. Now chancroid, it's caused by, etiology is Haemophilus duceri. So do cry, it make us cry. Now how they look like? So what is the characteristics, like what were the appearance of these chancres, these chancroids? So these chancroids they are unilateral, they occur unilateral. For chancroid, please remember U means they are unilateral, they form ulcers, and they are unilocular. Means they have single base. So means in these chancroid, ulcers were present when first there is primary chancre, and then this chancre will break up, it forms ulcers, and that will be painful. So whenever in genital ulcers, whenever there will be painful, so we just have to remember 2 disease which were painful in genital ulcers. The first one is the chancroid, that is very painful, and the second one is herpes simplex virus, that is also very painful. So only these 2 conditions are painful. If we will solve the MCQs, and in that we find that it is very painful. So all of the options, just rule out everything and just remain two options, that is chancroid and HSV. In chancroid, the ulcers will be soft and there is unilateral ulcers. So unilateral ulcers will be there. And chancroid, for this we also have to remember that in this we used to say bubo. We used to see bubo. Bubo is what is bubo? So bubo is basically when there is involvement of the lymph nodes, and in lymph nodes there is pus filled, enlarged lymph nodes will be there, like there is accumulation of pus will be there, then it is known as bubo. So it is a pustular. So bubo is basically a pustular. It is a pustular form. So it is a pustular form. So in chancroid, it forms bubo. So for the remember, we have to remember these are soft, they make us cry, they are painful, and we have to remember unilateral ulcer is there and unilocular will be there, and there is involvement of the lymph node. So there is that's why there it forms bubo. So bubo is there because there is involvement of inguinal lymph nodes. So inguinal lymph node involvement will be there. So that's why these are bubo. Now from here one question arises, like where we see the pseudo bubo, means there is no involvement of the inguinal lymph nodes, but these are pseudo bubo, means false bubos will be there. In which disease? In genital ulcer disease, we have one disease where we see pseudo bubo, that is donovanosis. Donovanosis, the don is pseudo bubo, means don is not like a don, it's a fake don. So we can remember by this, because I remember it like this: don is fake and it shows pseudo bubo, because there is no involvement of the lymph nodes, there is no involvement of lymph nodes, so there is no bubo. But when the ulcer occurs on the lymph node, if the ulcer occurs on the place of lymph node, then it forms bubo. But that one is the pseudo bubo, because it's not involved the inguinal lymph nodes. But in chancroid, what happen? It involves the lymph node, and in lymph node the ulcer will occur, that is bubo, and that forms pustular. So this is the difference between pseudobubo and the bubo. So for chancroid, please remember what we have to remember: these are unilateral, they form ulcers present unilateral, and unilocular will be there. They are painful, that's why the etiology is do cry, means they make us cry, and it shows pseudobubo. So these are the very highlighting points about the chancroid which we must have to remember, and whenever we used to see these findings in the questions, then we marked it chancroid, which are the soft chancres. Now that's all about the chancroid. Now we have to remember like how we can diagnose them. So for the diagnosis and for the treatment, what we have to do? So for the diagnosis, we do gram stain. So when we do a gram stain, on gram stain, as gram stain we see gram negative cocobacilli. As these are cocobacilli, means they are arranged one behind another like this. When they arrange like this, it looks like a school of fish. Please remember, if you find in question that there is school of fish or railroad track appearance, railroad track appearance. So when you see these two findings, that school of fish, as you see in this image, please very carefully, that they are just behind one another, as you can see in this like this. It's look like a school of fish or railroad track appearance. So these findings were also about the chancroid. So as it caused by, and how we can culture them for diagnosis also, we have one more point, that is culture. So on culture we do on MHA and on the chocolate, 5% chocolate horse blood agar. So MHA and CHBA, that is chocolate blood agar, we have to culture them. So for the drug of choice, now for the drug of choice for the chancroid, as in pharmacology we learn about the macrolides, that we have a mnemonic that where the macrolides were drug of choice. In the first letter in CLAP it comes chancroid. So in chancroid the drug of choice is, which one is macrolides? These are macrolides. So macrolides are drug of choice for the chancroid. C for chancroid, L for Legionella also, and A for atypical pneumonia, and P for pertussis. So in these four drugs, the drug of choice will be macrolides. And macrolides, which macrolides? That is the azithromycin. So in these conditions, in the chancroid, we used to give azithromycin, and how much quantity? It is given 1 gram stat, or also we can give ceftriaxone. If we want, we can also give ceftriaxone, but the dose here is 250 milligram, and if we give it intramuscularly, single dose. So this is about the treatment of the chancroid. So now let's revise by closing eyes. Just remember about the chancroid. Chancroid means these are soft ulcers. Yeah. Second point, these are unilateral, unilocular, and ulcers present will be there. It shows bubo. So bubo present is seen in chancroid, while pseudobubo is seen in donovani, because don is fake. So pseudobubo is seen in donovani. And also railroad track appearance and school of fish is also seen in chancroid. Please remember these points. These are very, very important. And also one more point, that it bleed on touch. But here I am writing it bleed on touch. For this point, there is one more point, that Donovani also bleeds very easily. Bleed on touch. Donovani also easily bleed on touch. How we can remember? Don को खून देखते ही क्या होता है? दिमाग खराब हो जाता है. तो खून देखते ही वो क्या हो जाता है? बौखला जाता है. सो डोनोवनी ईजिली ब्लीड ऑन टच. हल्का सा उसको थोड़ा सा बोल दो डोन को कि ये काम करना है, वो तुरंत खून करने को तैयार हो जाता है. तो दैट इज डोनोवोनोसिस. सो डोनोवोनोसिस easily bleed on touch. Please remember it. Donovanosis, when Don used to see anything or used to fight, he used to touch anyone, and he used to kill anyone. So on any cost, he used to kill anyone very easily. So that's why when someone killed, there is lots of blood is there. So we can also remember it like that, easily bleed on touch. Don't makes us easily bleed. Don't make us easily bleed. So that's why these are easily bleed on touch. So whenever in question you used to see that the ulcer is easily bleed on touch, it means that it is donovanosis. Please remember it is donovanosis. And while chancroid also used to bleed on touch, but in chancroid there is bubo, and in donovanosis there is pseudobubo. There is no lymph node, inguinal lymph node involvement in donovanosis. I hope this one is clear. I hope the chancroid disease will be clear to everyone up to the treatment. Now, next one is the herpes genitalis. As in herpes, whenever I used to remember herpes, this image used to come in my mind, like these vesicles used to come. So it's a grouped ulcers. So there are multiple, as you can see. So these are multiple, and these are vesicles, vesicle filled fluid. So in herpes genitals, so herpes is caused by HSV2 more than the HSV1. Please remember, it is caused by HSV2 more than HSV1. In herpes, what will be there? There is no ulcer. So ulcer will be absent. Ulcer present in chancroid and ulcer absent in genital herpes. Okay. Now the primary lesions will be vesicles, and when they get rupture, they form multiple tender vesicles, which are known as grouped ulcers, which are known as grouped vesicles, you can say. So, and if their margin get fused, they form polycyclic erosion. So polycyclic, because they are multiple, so they used to form polycyclic erosions. And in these there is no bubo, but there is bilateral enlarged tender lymph nodes. So in this there is bilateral involvement will be bilateral enlarged. Tender means painful. As I told you, tender disease will be only two, that is chancroid and the other one is HSV. So these are bilateral, while the chancroid is unilateral. This one is bilateral enlarged tender lymph nodes. But here, see, please remember, I told you that bubo is seen in chancroid because there is lymph node involvement is there. Here also enlarged tender lymph nodes will be there, but it is not bubo positive. It is bubo negative. Please remember, it is bubo negative, and it shows polycyclic erosions. Please remember these points. And for the diagnosis, what we have to do, as we all know from the microbiome, that for the diagnosis of HSV, there we have to do zinc smear test. Zinc smear test is done for HSV. And for herpes, what is the characteristic finding? There is multinucleated giant cell. Please remember, there is multinucleated giant cells will be there, and these are acantholytic cells. And for the serology, if we have to do serology, in that we find ELISA or antigen HSV glycoprotein. ELISA antigen HSV glycoprotein. But these are not very important. But just remember, zinc smear test we will done for herpes. And for the herpes, there is drug of choice. What is the drug of choice for herpes simplex virus? As it is virus. So please remember, for virus we used to give acyclovir. That is 400 milligram thrice a day for 7 days. हर दिन 3 बार देनी है, 7 दिन तक लगातार देनी है. क्या देनी है? एसाइक्लोविर 400 मिलीग्राम देनी है. और वी कैन यूज, इफ वी यूज 200 milligram, if there is not available 400 milligram, then we can give 200 milligram, but we have to give 5 times a day. We have to give 5 times a day. And if the infection is primary, means only the vesicles will be there is no rupture of the vesicles, then we have to continue this treatment for 7 to 10 days. And if it is secondary, infection secondary, then we have to give it for 5 days. But we have to give acyclovir in what doses? 400, or we can give it in 200. If 400, then for 7 days 3 times, and if it is 200, then 5 times per day. Now from here we can remember that kit. Like for herpes, which kit will be there? For herpes there is 5 number kit. Kit number 5 will be there, and which is in which color? It is in red color. Please remember this point. Red color is for herpes, because herpes we see red color. So kit number 5 we have to use. Now the next one, that is the lymphogranuloma venereum, LGV. As the name suggests, lympho means it involves the lymphatics. So lymphatics involvement will be there. And it is also known as climatica bubo, or lymphogranuloma inguinal. So please remember, it is known as climatica bubo or lymphogranuloma inguinal. What is the etiology? LGV is caused by chlamydia trachomatis. Please remember, chlamydia trachomatis, and in which L1, L2 or L3 form, and most common is L2 form. L2 form most common. It caused by chlamydia trachomatis. In primary stage, there is like asymptomatic. In primary stage, it is asymptomatic. In secondary stage, we used to see, as there is involvement of the lymph nodes, inguinal bubo we used to see. Because these are suppurative, lymphadenopathy will be there, and these are mostly bilateral. Genital ulcers will be absent. Please remember here, concomitant genital ulcers will be absent. Now in this we have to remember one point, that if there is involvement, suppose this one is our inguinal ligament, if it involves superior and inferior inguinal nodes, if it involves superior and inferior, then there one groove is formed, and that groove is known as groove sign of green blood. Please remember, green blood, and it is formed by chlamydia trachomatis. And this one is the inguinal ligament. It involves superior and inferior. So when this inguinal ligament, the other name for inguinal ligament, I am talking about inguinal ligament, other name is Popper's ligament, which you already know from the anatomy. Popper's ligament. So Popper's ligament means, for this we just imagine this image, like it involves superior, inferior, inguinal, above the inguinal nodes. So superior inguinal node and inferior inguinal nodes. So inguinal buba will be there. In this bilateral will be there. Climatic bubo is there. It caused by chlamydia trachomatis. And in the tertiary stage, it involves the lymphatics. It involves the lymphatics in tertiary stage. That's why its name is lymphogranuloma, because it involves the lymphatics. Now, if in the lymphatics it involves the male's lymphatics or whether it involves the female. So if it involves the male's lymphatics, then there is saxophone. Like we already know what is saxophone, but our if the penis looks like saxophone, then it involves in males, that is saxophone penis we see, then it is caused by LGV. And if we see isthiomean, mean, it means it caused by LGV and it is third stage. Please remember, it is third stage. In isthiomean, what will happen? There is destruction and hyperplastic changes we used to see. Now, for the diagnosis and treatment, for investigation of choice for the LGV, what is that? That is NAFT, NAT and CFT, NAT and CFT, that is nucleic acid amplification test, and CFT we have to do. And now what is the drug of choice? So as we know, the drug of choice here is tetracycline. And in tetracycline, how we can remember? For tetracycline, we used to remember Sri Lanka trick, in which the I is used for inguinal ligament. So doxycycline is used here, 100 milligram BD for 3 times. So as in the LGV, also the other for doxycycline, we have another alternative regime. For the alternative regime, as LGV is caused by chlamydia trachomatis, so we can also give here erythromycin, that is macrolides, erythromycin 500 milligram orally for 4 times a day for 3 weeks. So this is the alternative regime for the LGV, lymphogranuloma venereum. Now next move to the donovanosis. So in the donovanosis, as most of it part we already learned it. So donovanosis, we just remember it like don. So here is don. So who is the don? The don, when it sees, it gets hyper on seeing on small things and can kill anyone. So here don, it can easily bleed. So don can easily kill anyone, and so that's why on touch it can easily bleed on touch. So in the MCQ, when we are going to solve any MCQ, if we see that the by touching it easily bleed, so then it is a donovanosis. So bleed on touch, easily bleed on touch. So this is the specific line by which we can easily identify that it is a donovanosis. Now another thing, like donovanosis, as it is a don, and so in this first we have to remember etiology. So in etiology, it is caused by the granulomatis, that is Calymatobacter granulomatis. So Calymatobacter granulomatis, or another name we can say Klebsiella granulomatis. Klebsiella granulomatis. So this is the etiology of donovanosis. The other name for donovanosis is the granuloma inguinal. Please remember, it is granuloma inguinal, while in LGV that is lymphogranuloma venereum. So it is granuloma inguinale, or we can say granuloma venereum. Now in this, what happened? In this there is like incubation period is there, but in this, as it easily bleed on touch, so it looks like a beefy red color. So in this we see beefy red color ulcers. So beefy red ulcers which are painless, because in genital ulcers there are only 2 diseases which are painful, and in those 2 diseases were, the first one is the Chancroid and the other one is HSV. So all others are painless. So this is also painless, but here we see beefy red ulcers. Now The next one, in this, the inguinal lymph nodes are normal, because in Chancroid we used to see bubo, but here we used to see pseudobubo. Dons were fake. So dons were fake. They are very weak, but they appeared like they are very, very dangerous person. So that's why how we can remember that they are pseudobubo. So pseudobubo is usually seen in Donovanosis, and it easily bleed on touch. So these two questions we have to remember, that pseudobubo is also seen here, and also why pseudobubo, because it does not involve the inguinal lymph nodes. So in this, inguinal lymph nodes are normal. Inguinal lymph nodes are normal, means they don't involve the inguinal lymph nodes, that's why they are pseudobubo. But sometimes these ulcers grow on the inguinal node, so then it appears, so that's why it is known as pseudobubo, because the ulcers appear on inguinal lymph node, that's why. So here pseudobubo is seen, which are subcutaneous nodule in groin. Subcutaneous, which are subcutaneous, not, they are not in the inguinal node, so they are subcutaneous. Subcutaneous nodule in groin. Okay, now what we are going to do for the diagnosis. So for the diagnosis of donovanosis, which is etiology is Klebsiella granulomatis, we used to do a crushed tissue smear. In diagnosis, we used to do crushed tissue smear, in which we used to see Donovani bodies, as from the name easily remember, Donovani bodies. So we used to see Donovani bodies, and these bodies will look like a safety pin, like this. It looks like this, like a safety pin. So they are also known as closed safety pin appearance. Closed safety pin appearance. So in Donovani, we have to remember these 4 questions, like what is the, where we see Donovani bodies in Donovanosis. From in Donovani also Don comes, and Donovanosis is there, we can easily remember. But here closed safety pin appearance will be there. Please remember this image, we can easily, so that photographic image will be in our mind, and we can easily solve this question. And pseudobubo is here, easily bleed on touch. Chancroid also bleed on touch, but not easily. So here easily bleed on touch, and it appears like beefy red ulcers, and dons are fake, so that's why pseudobubo are seen here. Now what test we do? So for the diagnosis, we also used to do CFT test or NAT, nucleic acid amplification test. Now what is the treatment of this? So for the treatment, we used to give azithromycin 1 gram start, like 1 gram per week for 3 weeks, or we can also use 500 milligram daily for 3 weeks. We can do whatever we want, and or we can continue this treatment until the ulcers will heal. So this one is the all about genital ulcer disease. Now let's have a quick recap here. So in the genital ulcers, there are tenders, genital ulcers. Ulcer disease, we see about the tender and non-tender. In tender means painful, tender means painful. So in painful, which ulcers were painful, which disease of the genital ulcers were painful? We know 2. First one is the Chancroid, and the other one is the Herpes simplex virus. And non-tender, all rest, and total genital ulcer disease were 5, in which 2 were here. Now the rest of 3 were here. The first one is the LGV, the Donovanosis, and the syphilis. So now what another difference between Chancroid and HSV? So in HSV or in Chancroid they are unilateral, ulcers were present there, and they are unilocular. And the another one in HSV, in herpes, they were bilateral, they were enlarged. And now in the LGV, Dono and syphilis, in syphilis also they are bilateral, but we can easily differentiate HSV and syphilis by that they are also bilateral, but HSV is tender while syphilis is non-tender. So this is the difference between HSV and syphilis. Now the LGV and Donovanosis. In Donovanosis there is no inguinal lymph nodes is involved. Here in Donovanosis we see Don is false, like pseudobubo. So in this pseudobubo we will see And in LGV, lymphogranuloma venereum, we see a belt, that groove of green blood we see. And also in LGV, there is suppurative lymph node involvement will be there. So suppurative lymph node involvement will be there, and this one is the main difference here. I hope this video is very useful for all of you guys for revision purpose. Thank you so much, and bye bye guys.